This is Alyssa Ritchke, and today I'm just going to be talking about different nursing certifications. So the certifications I'll be talking specifically about is related to our patient population for the ICU. So there's a few different certifications available to ICU nurses. Primarily, the CCRN is the biggest one that we see ICU nurses. It's one that's more comprehensive to ICU care, but there are other ones available as well. So the cardiac surgery care is available for those who are taking care of those immediate post-op open heart patients. And then there is also the trauma certified registered nurse as well, which is for those nurses who are taking care of a lot of trauma patients. So some of the benefits to certification. So there is the opportunity for discounts related to malpractice insurance for individuals, and then I know for like hospitals as well, if they have a certain percentage of nurses who are certified, they can get discounts as well. And also, I think just patients are becoming increasingly complex, especially in the last year. We've seen just, sicker and sicker patients coming to the ICU needing care. And these certifications really just help, have the knowledge and confidence to try and to be able to navigate our current healthcare system. And they have done studies, and it's shown that nurses with certification say that they think they're able to make decisions more confidently, and they feel good about the decisions that they're making. It's also a really good way to show just your commitment to your career development and advancement, whether that be within our institution or just advancing your career other ways. Like, for example, for some advanced practice degrees, you'd need a certification. Like if you wanted to go to CRNA school, all nurses who apply to go to be a nurse anesthetist will, they do have their CCRN. And then additionally, just, working in the ICU, it's a little intimidating. There's a lot of knowledge, a lot of, from nurses and physicians. And it's just a great way to kind of set yourself apart and just show that, you've taken the time and the commitment to learn all of the skills and to prove that you are, competent to be taking care of the sickest patients. So the CCRN exam, so this is put on by the American Association of Critical Care Nurses, and this really just validates that nurses have the level of knowledge that they need to care for the most critically ill patients. You do not need a membership to the AACN. However, for the fees, you do get a reduced fee to take the exam, so $245 for members, non-members $360. The policy at our organization is that if you pass the exam, you do get reimbursed. So you just need to submit your receipt and proof of your certification, and then you'll get reimbursed for that. So the requirements to be able to sit for this test, so practice as an RN or an advanced practice RN for 750 hours of direct care in the past 2 years, with 875 hours occurring in the past year, or else you can do within the last 5 years, and that would be 2,000 hours of direct care with 144 hours occurring in the past year. So the actual exam, so you have 3 hours of time are allotted. It's 150 questions. 125 are graded, and then 25 are just used for statistical data for coming up with new questions for future tests. So 80% of the content is going to focus on clinical judgment. So they break it down specifically to how much of the test is on which systems. So you can see, for example, 17% cardiovascular, and then it continues through all the systems. And then 20% of the content focuses on professional caring and ethical practice. So this certification needs to be renewed every 3 years. So you have a couple options. You can just take the test over again if you feel confident, or you just need proof of continuing education requirements. So they require 100 CERPs every 3 years, and those are similar to CEUs, and they have it kind of broken down for specific areas that you need to have credit for. So the certified cardiac surgery care, so this is a subspecialty certification. It's for the nurses who care for the patients, the acutely and critically ill patients after cardiac surgery. So this is within the first 48 hours postoperatively. So the requirements for hours worked are the same as the CCRN, except of course it's going to be in caring for post-op cardiac patients in the first 48 hours. And then the fee, $135 for members, and non-members is $225, but again, you get reimbursed when you pass. So the trauma certified registered nurse, so this is actually put on by the board certification for emergency room nurses. So their requirements are not quite as stringent as the critical care. So they encourage you to have 2 years of experience caring for trauma patients, but it's not required. So this could be at any point of taking care of trauma patients. It doesn't need to be in the ICU. It could be taking care of them, after they leave the ICU. And it's kind of really geared towards ER, flight, and ground transplant nurses as well. The exam fee for this is $230. The exam, so it's 3 hours, kind of similar to the CCRN, 175 questions, 150 are graded, 25 are used for data, and you have to get 104 correct answers to pass. So they also break down the exam content for how many questions will be spent on each one. So you can kind of read through those and see. So for head and neck trauma, there'll be 33 questions. Trauma related to the trunk will be 37. Extremity and wound, 25. Special considerations for trauma patients, 25 questions. Continuum of care, 15. And professional issues, 15 questions. So I just wanted to talk about some additional benefits. So I think kind of with the state of things in the world, I think it's important to think about as nurses what we can do to do our part. There's been a big shift in really looking at how can we provide culturally responsive care. There are specific certifications for this, which would be the transcultural nursing certification, which really seeks to advance cultural competence for nurses. And I think this is a great way to, I think as nurses, we need to be patient advocates. And I think in the past year, it's just really highlighted the need for advocacy for our minorities and our patients of color. So I would personally really encourage nurses to get this, to look into the certification as well. Also within healthcare, it really can help with meaningful communication. And I think also this past year, we've been really pushed to the max. And the more we can look at things like meaningful communication, I think the better it is for our healthcare system and for our relationships within healthcare as well. And certifications have been shown to really enhance workplace empowerment. So within that is structural empowerment, and some of the models with that is like informal power is something that after someone has gotten a certification, they have this kind of sense of informal power. And it really helps with developing communication channels, and that's with not only with leaders, but with your peers and outside the organization as well. It also really helps, the more certified nurses we have, it really does help support leadership and really helps with sustained change. It helps us to find ways to make meaningful change. With certifications, it's proven and to show improved processes of care, improved work culture, job satisfaction, retention, and also improves quality of care. So you can see how having more certified nurses really does just create a better culture. It's better for the patients, it's better for the staff, it's just better for everyone. And additionally, so having all these factors really helps create that culture of inquiry, which is what we look for in trying to look for better ways to do things. So the best way, the evidence way to do things. So if we have all of our nurses kind of looking towards ways that we can be doing things better, then we can really look at meaningful change and what that means for our hospital. So kind of in conclusion, so there's a lot of benefits to certification. It's good for professional and personal development. It, of course, is a personal decision, something that you have to kind of want to do yourself. But it does really it's really good for patient outcomes as well. There's different certifications you can do for whatever, you feel is something that you would want to become more knowledgeable in. And just know that there's resources available. So, online, for each certification, they have, books with review and practice questions and quizzes. And then within our institution as well, we do have classes available to help you before you take some of these bigger certifications, just to help you get that pass on your first attempt. And here are the references, and that's all I have.